Tobacco cessation is when a person stops tobacco use with the goal of achieving permanent abstinence. Usually, patients are not aware of oral effects of tobacco use. So, during the first appointment, if we notice any change in the oral mucosa, we have to describe this to the patient, like nicotine stomatitis or white hyperkeratinized oral mucosa, or if we notice that the periodontal disease is getting worse, or if we notice staining in the teeth. We review the medical history and we see that the patient is a smoker. We begin cessation discussion in accordance with the 5A model of smoking cessation. We ask the patient if she or he ever smokes or uses any type of tobacco. We need to know the type, the frequency, the amount, the triggers, and if the patient has ever tried to quit. Next, we advise the patient. This is the part where we tell the patient if there has been any change in the oral mucosa or if their periodontal disease is getting worse, and we advise the patient to stop smoking to protect the patient's current and future health. Next, we assess the patient's readiness to quit. A change in behavior occurs gradually. The patient might be uninterested or unaware that tobacco can do any harm to his mouth or his general health. They may be unwilling to make a change. This is the pre-contemplation stage. Or the patient might be considering a change. This is the contemplation stage. Or the patient might be in a preparation stage, where they experiment with small changes, like switching to a different brand of cigarette, tapering down use, and the action stage when they stop smoking. Most people are going to relapse before the change becomes truly established. So when we assess the readiness to quit, we're going to ask the patient, are you ready to quit? Any thoughts on considering quitting? If the patient is unwilling to quit, then we encourage the patient to indicate why quitting is personally relevant to them. For example, they might have kids living in their house. There might be a health concern like cardiovascular disease or hypertension. We also ask the patient to identify potential negative consequences of tobacco use. For example, shortness of breath, exacerbation of asthma, heart attacks, strokes, cancers of larynx, oral cavity, pharynx, esophagus, pancreas, bladder, and cervix. We also ask the patient to identify potential benefits of stopping tobacco use. They might recognize that it's going to improve their health, or the food will taste better, they're going to save money because cigarettes are expensive, they're going to set a good example for their kids, or they are going to have a better self-image. We also want to know what is stopping the patient from quitting. Sometimes they are afraid of the withdrawal symptoms, or they have fear of failure, or fear to gain weight. They lack support from their family, and they are depressed, or simply because they enjoy smoking. The goal is to make them think about the benefits of using tobacco versus the benefits of stopping using tobacco. And if the patient is ready to quit, we provide assistance. We provide pamphlets with information, resources from our smoking cessation resources. And we can provide a referral, especially if the patient has multiple other problems or needs intensive treatment. We can also assist the patient setting a quit date, ideally within 2 weeks, and also give the patient specific referral information for a smoking cessation program. 1 week to 2 weeks. Then we need to arrange a follow-up visit, and this is important for the patient because they know that the clinician is going to follow up their progress. The follow-up visit should be scheduled 1 week after their quit date. During the follow-up visit, we congratulate the patient on their success, and if the patient relapses, then that's okay. We just make the patient think about what made him relapse, what triggered it, and just make it a learning experience, and think about different ways to avoid the relapse from happening again. And we set another quit date. And if the patient is not ready to quit, I'm going to state, if it's okay with you, I would like to check in with you at your next dental appointment to see where you are in your decision making.